Hello everyone, I hope you all are doing good. The topic of this video is routes of drug administration, or the areas from where a drug or medicine can be given to a patient. Our objective of administering the drug through different routes is that the drug reaches the blood, which is also known as bioavailability. Bioavailability can be defined as the amount of drug in the blood. So, these different routes for the drug administration include oral route, which means through the mouth; sublingual route means under the tongue; parenteral routes means routes that do not reach GIT; topical route means on the surface of body; inhalation means directly towards the lungs; rectal route, which means towards rectum or anus. First of all, we have oral route. Majority of the medicines are taken through mouth. Either they are tablets or syrups. This is a very convenient route as the medicine can be self-administered. It is a pain-free method and also do not require any specific procedure to be followed while administering the medicine. Effect of medicine appears after some time, that is 30 minutes or longer. This route has some disadvantages. That is, this route is not suitable for emergency situations. That effect of medicine takes a longer time to appear, so this route is not suitable for emergency. Some drugs may also have unpleasant taste as the medicine has to go to the stomach, so there are chances that it may be deactivated by the enzymes present in stomach. Or there are also chances that the medicine can cause irritation in the stomach. When the drug reaches the liver, they are broken down by the action of liver and their amount is decreased. This process is called first pass effect. The second route is sublingual route, means that the medicine is taken by placing it under the tongue. You all may be familiar with the tablet used for acute or sudden chest pain called NGZ. This tablet is taken usually by placing it under the tongue. As there are a lot of blood vessels under the tongue, so the drug enters the blood readily and shows its action. As the medicine does not go towards the liver, so it is not broken down and there is no first pass effect. Likewise, the drug taken through this route cannot be deactivated by the stomach, as it do not go towards the stomach. It directly enters the blood. Also, this route is suitable for emergency situations, as the drug shows its effect readily. There are some disadvantages of this route, as the taste of some drugs may be unpleasant and larger doses cannot be given through this route. Spitting out of the tablet can terminate the effect. After that, we have parenteral route of drug administration, drugs given by routes other than digestive tract. Usually, the drugs are injected somewhere in the body where they enter the blood. These routes include veins called as intravenous or in muscles called intramuscular or subcutaneous. Through this route, the drug directly enters the blood, so there is maximum amount of drug in blood, which means 100% bioavailability, as the drug gives most rapid response, so this route is suitable for emergency situations. There is no first pass effect or irritation in stomach or GIT. Its disadvantages include the pain at the site of administration. A specialist is required to inject the drug. Microorganisms can also be introduced in blood by contamination, and vascular injury or other issues may occur if the needle is broken. The next parenteral route is intramuscular route, which is also called IM route. Injection is made into a large muscle. It provides rapid onset of action, means the effect of drug appears quickly after the administration, usually under 30 minutes. Larger doses of drugs can be given and less pain is felt as compared to subcutaneous route. This route is not suitable for the substances that cause irritation. There is also a risk of infection, and a trained person is required for its administration. Subcutaneous route. Injection is given in the fatty tissues beneath the skin. As you all can see the diagram of skin, there is a layer of subcutaneous tissues above the layer of muscles. As subcutaneous tissues have very few blood vessels, so absorption is slow and sustained, which means small amounts of drugs keep entering the blood slowly, so the response of drug is for long term. Insulin, which is used to manage diabetes, is injected into the subcutaneous tissues or through SC route. This route also have disadvantages as it is not suitable for substances that cause irritation. Larger volumes of drugs can be painful, and irritation and pain at site of administration can occur. After the parenteral routes, we have topical route through which the drug is given by applying it on the skin to achieve the therapeutic response. Medicine can be given easily by this route by applying it on the specific areas on the skin. There is no pain while administration and also no first pass effect or GIT irritations as the drug do not enter the stomach or GIT. Irritation can occur at the site of administration. Enzymes present on the skin can degrade the drug and reduce its potency. After that, we have pulmonary administration, which is also called inhalation, which means taking the drug by inhaling it or taking it directly towards the lungs, as there are alveoli present in the lungs which are rich in blood supply. So, by pulmonary administration, the drug substance rapidly enters the blood and shows its action. But there are chances that its contents can be contaminated or some drugs can cause irritation in lungs. In the last, there comes rectal route of drug administration. The drug is inserted through the rectum in form of semi-solid suppositories. This route is used when the patient cannot take medicines orally or through any other way, or when the patient is unconscious. Through the rectal route, the drug is safe from degradation in the stomach and the first pass effect. This route is important for the children and aged people. Usually, this route is not used and is inconvenient. So, that was all. I hope that you all understood the contents of this lecture. So, do like, share, and subscribe my channel. And goodbye.